Good day, everyone. Welcome to today's episode of Health Talks. My name is Dr. Deepak Moses Ravindran. I'm a periodontist and implantologist with more than 16 years of experience in this field. Today, we're going to look at other dental conditions apart from dental caries, which cause a lot of pain and discomfort for the patients. So these are generally called as acute oral conditions, and we are going to look at them one by one. The first condition is called as pericornitis. Now, this is nothing but an inflammation or swelling that is generally present around an erupting third molar. So, this is generally seen in children who are about 18 years of age till about 21 years of age. So, this inflammation is around the inflamed third molar region, and it causes a lot of pain and discomfort for the patient. The patient generally has a lot of pain, swelling, inability to open the mouth, and this could be sometimes life-threatening also, with leading to a condition called as a 𝗪𝗲𝗃𝗃 angina, which is a swelling that is very close to the throat. So this has to be dealt with at a very early time. So like I said, this is generally seen around 18 to 21 years of age. It affects both boys as well as girls, and it generally causes a lot of pain and discomfort for a patient. This is an acute condition, so generally patients get up with a lot of pain, and it is a sudden onset type of pain. So when you go to your dentist, generally the dentist would take an intraoral X-ray if the patient is able to open the mouth, or if the patient is not able to open the mouth, the dentist will take a full mouth X-ray, which is called as an OPG. So this will help us to assess the position of the tooth inside the bone. So the most common tooth affected is generally the mandibular third molars, whereas it can affect the other teeth also inside the oral cavity. So when a patient has acute pain, discomfort, and inability in opening the mouth, the dentist generally recommends a course of antibiotics. What also has to be done is that area has to be gently cleaned with warm saline. The patient can be sent home with the instruction of gargling that particular area. Brushing is also very mandatory in that particular area. And once that is done, once the inflammation reduces, once a course of antibiotics for either 3 days or 5 days is given, then the dentist will go ahead with a procedure called as an operculectomy. So this is nothing but removing the tissue around the inflamed third molar area. Okay, this will cause a lot of relief for the patient. However, if on the intraoral X-ray or on the OPG, it is found that the tooth is impacted, that means the tooth is inside bone, at this particular point of time, there is no other option, but then the dental surgeon will have to extract this particular tooth. The reason being that it is going to cause a recurrent problem for the patient, and this tooth is going to give a lot of pressure on the teeth in front, which will then cause other problems inside the oral cavity. Sometimes an impacted tooth can also be growing sideways, and this can also cause ulcers on the outer surface of the cheek. So it's better to get it done at an earlier stage. So remember, as far as pericornitis is concerned, it generally affects children 18 to 21 years of age. It affects both boys and girls. Generally is present around the lower last molar, which is called the wisdom tooth or the third molar. Initially, we can start off with a course of antibiotics, and if it doesn't reduce, the tooth may then have to be extracted as one. The next condition we're going to see is nothing but a gingival abscess. So an abscess is nothing but a collection of pus or pus cells into a particular area. So inside the oral cavity, you can have an abscess on the gums, involving both the gums as well as the bone, or involving the third molar area. So you can have a gingival abscess, which is only confined to the outer gingiva, a periodontal abscess, which covers both the gingiva as well as the bone, and a pericorneal abscess, which generally affects the inflammation around the third molar tooth. Okay. So generally an abscess is caused because of food impaction. If food gets stuck into a particular area, it generally causes pain and discomfort. So the common complaint that the patient will come to you is, patient will generally say that I had something to eat, it was sharp. For example, they might have gone to a movie theater, they might have had popcorn. Popcorn kernel gets stuck inside the tooth. They might have had fish. A fish thorn can get stuck in the tooth. So that is also a reason when you will generally get an abscess. Okay, so again, this is an acute condition. Patient will generally give a history of eating something that has gone and impinged in the gingiva, or it can be iatrogenic also. For example, patient might have gone in with a new crown or a new type of appliance, orthodontic appliance inside the oral cavity. So this can also cause an immediate swelling or pain on the next day. So again, since this is an acute condition, patient will have a lot of pain and discomfort. So when the patient comes to a dentist, initially after assessment, if needed, a local X-ray can be taken. So an intraoral X-ray can be taken, and once the intraoral X-ray is taken, we'll just have to diagnose the depth of which the infection has gone to. It is only involving the gingiva or it's involving the gums as well as the bone. So if it is involving the gums and the bone, it is then called as a periodontal abscess. If it is only involving the gingiva, that is the outer portion of the gingiva, a simple cleaning will generally help. You can give the patient a mouthwash, a rinse, and generally patient is good to go. If, however, a food is being impacted into the particular area, there's impingement of food into the particular area, that area will have to be curated. So we will have to give a local anesthetic in that particular area and drain the abscess and remove the irritant into that particular area. So this is what generally has to be done if it is a gingival or a periodontal abscess. Now coming to a pericorneal abscess is generally seen around an impacted or a partially erupted third molar tooth. So again, in this case, an X-ray will have to be taken. If the tooth is partially erupted, half inside bone and half outside, the tooth might have to be extracted. However, if the tooth is coming inside the oral cavity, like I said, a pericorneal abscess can be generally seen in children 18 to 21 years of age. So if the tooth is coming out inside the oral cavity, the tooth can be saved. So at that particular point of time, a proper irrigation can be done, scaling and debridement of that particular area can be done, and the tooth will generally erupt inside the oral cavity. The other group of conditions are necrotizing ulcerative gingivitis or necrotizing ulcerative periodontitis. Now, nowadays, with a lot of importance given to nutrition and a lot of children do take a lot of nutritious food, we see a rapid decline in this sort of cases. But however, necrotizing ulcerative gingivitis and necrotizing ulcerative periodontitis were very common lesions till the 1940s and the 1950s. So it's generally seen in patients who are malnourished. It was very commonly seen in soldiers during World War II. It was seen in sailors who used to travel for a long period of time because they did not have a good nourished meal. So this is again an acute condition that is seen inside an oral cavity. Patient will have pain. There will be other systemic problems generally associated with these patients. So generally patients might be immunocompromised, might have HIV/AIDS, might be have tuberculosis, or might have any other condition which is making them cause this sort of actual problem. Like I said, malnutrition was the problem for acute necrotizing conditions before, but nowadays with a lot of importance given to nutrition, that we have seen a lot of decline of cases of necrotizing ulcerative gingivitis or necrotizing ulcerative periodontitis. However, if there is an associated medical condition that is also involved with that, like HIV/AIDS or tuberculosis, the possibility of getting an infection is quite high. So how will these patients report to you? So these patients generally will have acute pain, severe pain, they will not be able to eat or chew anything. These patients will also have ulceration of the gingiva. So the gums will keep peeling with time. So this is quite dangerous. You will have bleeding from the gums and the patient will give a very foul smell in the oral cavity. So the smell is quite pungent and it is quite repulsive, and generally you can smell these patients from about 2 or 3 meters away. Okay, so since this is also involved with a systemic condition, it is better to get these sort of patients admitted in a hospital, identify what the underlying problem is, and then treat the gums. Now, as far as the gums is considered, again, palliative care only can be given for these sort of patients. Okay, so we can again wipe the area with warm gauze, clean the area. If needed, we can go ahead and give a saline rinse to that particular area. It's very, very important for these patients, especially patients with necrotizing ulcerative gingivitis or necrotizing ulcerative periodontitis, to not brush that particular area, because the infection will start to spread further deeper into the deeper tissues also. Okay, so you can rinse your mouth, you can do a warm water rinse, but you can never brush that particular area. More importantly, like I said, since it is involved along with other systemic conditions, it's very, very important that you treat the main reason. For example, if the reason is malnutrition, or the reason is HIV/AIDS, that has to be treated first, and then automatically you will see a improvement in the oral health. The last group of conditions that again cause pain or discomfort for patients is a very common aphthous ulcer. Okay, so these ulcers generally come for patients when they have any sort of stress, any sort of discomfort, they're not taking a balanced diet, when they tend to eat a lot of fast food, junk food outside, when they eat without a lot of supplements, you will generally end up having a lot of aphthous ulcers. So generally aphthous ulcers, if you see, these conditions will generally come for children when they are going in for any board exams or any competitive exams or any stressful condition that is there at that particular point of time. So these ulcers are also associated with a life cycle or lifestyle that you are with. Okay, so generally after these exams get over, or once that stressful situation is gone in their life, or once they have a particular project that they have to finish, then at that particular point of time, the ulcers will tend to go away. So these ulcers are again present on the lip, on the gum, they can come on the tongue or on the upper palate also. So these ulcers are very painful. You will have very tough difficulty in eating, chewing, or even taking a mild coffee or a tea. So for these patients, we generally advise a 1 week time wherein these patients are asked to take a very bland diet. Okay, so a patient is asked to take bland diet for a period of 1 week, and in this 1 week, you will see a reduction in the number of ulcers. Okay, we can also give topical medications. We can also give multivitamins for these patients, but the most important thing is to have a bland diet over a course of 1 week, reduce whatever stress or whatever environment they are in that is causing this particular problem for them. Okay, so even if you give medication, it will take about 1 week. Without medication also, this will go away in 1 week. So main is a lot of bland diet, a lot of greens, a lot of vegetables, avoid a non-vegetarian food during this particular point of time, and see that you do not bite or chew on that particular area till the ulcer completely heals. Okay, so once the ulcer heals, it is also very important to get it checked repeatedly again if you're getting an ulcer in other places inside the oral cavity. So this means you might be malnourished or you could be anemic, especially in the women patients. Okay, so as far as aphthous ulcer is concerned, good home care, good nutrition, bland diet during the course of the meal, and multivitamins is also very, very important. There's no line of treatment as such, but all these things that you can do at home is very, very important. So right now we have seen 4 or 5 different acute conditions in the oral cavity. One is pericornitis, which is inflammation around an erupting third molar. Then you have an abscess, which can occur in the gums, in the gum and in the bone, or around a third molar. Okay, we saw necrotizing ulcerative conditions of the gingiva, which is again, like I said, not very common now. And last but not the least, we saw aphthous ulcers, which are painful conditions which generally pop up in the lip or in the gum. Okay. All these conditions are treatable and manageable. You do not have to worry about them. If you have a problem, always visit your dentist and you can get it treated at the earliest. Thank you.